Nancy, I see you're here. Would you like to do a mic check? Thank you, Mr. Mayor. We'll start with the land acknowledgement. We acknowledge that we are on the lands of the Anishinaabe Nation. This spot where we gather is the traditional lands of the Three Fires Confederacy, the Ottawa, Potawatomi, and Ojibwe. We also recognize that this land is now home to the Delaware Nation. This land was settled through the McKee Purchase Treaty of 1790, and we as beneficiaries of the treaty must recognize our responsibilities, including our collective responsibilities to the land and water. Mr. Mayor, we do not have a supplementary agenda this evening. We have one disclosure of pecuniary interest, and that is Councillor Harrigan with regards to 14A, which is the Ontario Health Team Strategic Plan presentation. I just also want to note that today there has been a global Facebook outage. Therefore, there's no live Facebook stream today. However, the YouTube stream is operating fine. So, Mr. Mayor, I'll pass it back over to you.
Okay, we'll move into recognition. I'm absolutely thrilled to sit tonight and talk about the Seniors Awards. In this unprecedented historic time, the committee was so pleased to receive a group nomination from Catherine Kielstra, Chatham-Kent Health Alliance Volunteer Resources, that recognized older adult volunteers who, in quote, overcame challenges and bravely displayed an incredible amount of passion and love for their community during the COVID-19 pandemic time. We're thrilled to announce that this year, the 2021 Senior Achievement Award will recognize and be presented to this group nomination, which includes 120 plus names of older adult volunteers from across Chatham-Kent who came together to create the great client experience for so many at our mass CK vaccination clinic held at the John D. Bradley Center over the past year. These volunteers were a key piece to the comfort and ease that enabled and kept this massive operation running smoothly. So thrilled to announce that, and I'll pass it over to Councillor Latimer to announce the Ontario Senior of the Year.
Thank you, Mayor Caniff. Tonight it is my pleasure to announce that Carolyn Powers has been named winner of the 2021 Ontario Senior of the Year Award. Congratulations, Carolyn. Carolyn has volunteered 60 plus years for various organizations in our Chatham-Kent community, including Scouts Canada, Sertoma, Master's Son, Drug Education Alliance, Canada Day committees, Racing Against Drugs, Home James, and she remains an active Legion member. Congratulations again, Carolyn. The Mayor and myself look forward to presenting Carolyn the 2021 Ontario Senior of the Year Award in person later this week. For those interested in learning more about all those nominated for the 2021 Chatham-Kent Senior Achievement Awards, nominee listing can be found on the Chatham-Kent website under Municipal Council, Local Government, News and Media Releases. Now, as the current chair of the Chatham-Kent Senior Expo and Achievement Awards Committee, I would like to take this opportunity to thank the members of the 2021 Chatham-Kent Senior Achievement Award Committee, namely Karen Herman, Eleanor Mifflin, Catherine Vanek, Councillor Sakachi, and Councillor Thompson, and Jessie Passa, our administrative assistant. On behalf of the Mayor and Council, I commend this committee again for their ongoing volunteer dedication and especially their guidance and perseverance through the past 2 unprecedented years. As all of you are aware, the Chatham-Kent Senior Expo and Achievement Awards celebration, historically celebrated annually at the Blenheim Arena for 3+ decades now during Seniors Month of June, has been canceled since 2020 due to the pandemic. Viewing anticipated ongoing restrictions and distancing challenges surrounding any larger gatherings, especially with regard to seniors. Over this past summer, the committee met with other historical community senior expo organizers to explore the possibility of safely holding a larger collaborative community senior event at the Bradley Center in June of 2022. This would involve presentation of the Chatham-Kent Senior Achievement Awards, but also ideally provide an opportunity for education and service promotion of all of our 11 Chatham-Kent older adult senior centers in a central, age-friendly, and fully accessible facility with adequate parking, space, and acoustics. It has been recommended that this collaborative community event be named the Chatham-Kent Celebration of Older Adults going forward, and that myself and Councillor Marjorie Crew co-chair this event planned to be happening Wednesday, June 1st, 2022. Appreciation is also extended to you, Mayor Caniff, and all of my fellow council members for your ongoing enthusiastic support for any community events that celebrate our older adult community contributions and their continued health, safety, and well-being living here in Chatham-Kent. This includes the time for this presentation tonight and the support from the Mayor and Clerk's office and team to prepare and present this evening's recognition ceremony. So thank you again to all.
With that, Councillor Thompson, you had a question or comment?
A question and a comment. I suppose first off, I just wanted to echo Councillor Latimer's statements. It's always really inspiring to see all of the hard work and dedication that our older adults have to all of our communities, specifically for us in South Kent, the Blenheim area. Usually a highlight of the year to take part in the in-person events, and that's something we've missed out on for the last year or two now. So I was wondering, as Councillor Latimer kind of alluded to, nothing happened this year, that if the funding could be encumbered to 2022. I believe that's a question for Gord Quint.
Thank you, Mayor Caniff. That's Gord Quinton, Chief Financial Officer speaking. Yes, Councillor Thompson, we'd be very happy to encumber the $3,000 that was set aside for the 2021 event and carry that forward to 2022 to make $6,000 available for the special event next June.
That'd be excellent. I think as we all kind of continue to cast our gaze forward, maybe further than we'd all wanted to, 2022 is going to be a pretty special year, and I know the committee will be happy to hear that that's going to be done. So thank you very much.
Seeing no other questions, we'll move on to deputations.
Thank you, Mr. Mayor. This evening we have 7 deputations, and they are all related to item 17D, which is the vaccine policy for council and committee members. The clerk's office will read them now. The first one is from Jeff Shammelhorn. Dear council members and guests, I am respectfully writing this with regards to this evening's agenda and in part regarding the overall policy of the municipality pertaining to vaccine policies for employees. I'm a retired sergeant at the Chatham-Kent Police Services with 30 years of exemplary service as of 2015. Firstly, I'm not writing with respect to the constitutional arguments of the municipality's policy or any infractions relating to privacy of health records or informed consent. Those arguments require a much broader game table and will hopefully be resolved at a provincial and federal levels in the coming months. What I am writing to you about specifically is a health-driven concern. As I am surmising, the policies in this evening's agenda are moving forward solely based on the health and welfare of employees and residents of Chatham-Kent. It would appear that Chatham-Kent has adopted a very much rote clause form of policy in that it mirrors policies of other governing agencies rather than specifically meeting the needs of this community. With that approach, unfortunately, details which can be paramount to the safety of citizens can be easily overlooked. The present policy, which, if this evening's agenda is passed, will apply to council, neglects to protect our community in one very simple oversight. Credible information and data from the local health officials and the Food and Drug Administration, the Center for Disease Control, and the World Health Organization have concluded, inarguably, that both vaccinated and unvaccinated individuals can and are susceptible to carrying, spreading, and infecting others in the COVID-19 virus. This evidence behind this is indisputable. My concern is two-pronged. One, why has the municipality chosen to only require unvaccinated employees to test for COVID-19 every 72 hours, when statistically 70% of the workforce is vaccinated and also a carrier of COVID-19? As all employees are potential carriers, the implementation of testing only unvaccinated members becomes both negligent and appears punitive rather than proactive. The corporate mission of Chatham-Kent is as follows. The corporation of the municipality of Chatham-Kent is a proud, proactive, and progressive team committed to innovation and leadership through the provision of services, enhancing the quality of life for our community. If the policy is indeed to protect and safeguard the community, the members of this community, why would you neglect to test 70% of the workforce? Bear in mind that with being vaccinated, your symptoms are lessened. Your ability to infect is not. And if you show lesser symptoms, you are less likely to self-monitor and stay home if you are infected. 2, as a citizen of this community, I now have to regulate any dealings I may have with a municipal employee, i.e. police, fire, paramedic, and that I have no idea if they are infected, as the majority of their staff do not test. As this virus is potentially deadly, what measures in dealing with the public will the municipality put into place regarding community interaction with untested members of the municipal staff? Respectfully, Jeff Shamahorn.
Next deputation is from Diane McGuigan. There has certainly been government coercion, and we all know that is illegal. As our elected officials, we rely on you to protect our rights. But I am understanding that there may be a motion for a mandatory vaccination for council and committee members, and this is a violation of the Charter, Constitution, and Nuremberg Code. Of course, this would be the beginning to then forcing the injection on everyone. What is injected into our bodies should only be done with a person's legal age consent by making their own informed decision. Every human deserves this right. What are the ingredients of the vaccine? That should be the first question. We all have heard that one ingredient is aborted fetal cells, which goes against many people's beliefs. How many deaths and adverse side effects have you personally taken the time to research because the media will not report the facts? Thank you for your attention to this deeply concerning topic on your agenda. Sincerely, Diane McGuigan.
Deputation by Charlie Van Kesteren, 2021, October 4th. 301 Queen Street, Chatham, Ontario, N7M 2H5. Reference Agenda Item 17D, COVID-19. Vaccination Policy for Council and Committee Members. Esteemed Mayor Caniff and Council members, my name is Charlie Van Kesteren, and I live at 301 Queen Street, Chatham, Ontario. Please allow me to express my thoughts on the motion by Councillor Foz and the requested policy draft regarding vaccination policy for councillors, committees of council, and local boards. I believe it can be successfully argued that views on mandated vaccines generally fall into one of two camps, liberal or conservative, or said differently, political right or left. Conservatives tend to consider mandated vaccines as government abuse of power and assault on freedom and personal rights, whereas the liberal view in general is in agreement with the present government's approach. If the assessment of political attachment to this issue is true, then how can we continue as a democratic entity if we exclude and marginalize those with opposing views? What right does one have to force another to sacrifice a belief to the point of losing their job for non-compliance, especially if that which is mandated is a weak solution at best? On September 27, 2021, the Fair Works Commission, Government of Australia, released its decision on a pending vaccine case. In part 2 of the report, pages 32 to 44, there are bombshell statements against mandatory COVID-19 vaccines. A link has been provided. Though from Australia, I believe conclusions drawn are applicable worldwide. From the report, 180, the statements by politicians that those who are not vaccinated are a threat to public health and should be locked out of society and denied the ability to work are not measures to protect public health. They are not about public health and not justified because they do not address the actual risk of COVID. These measures can only be about punishing those who choose not to be vaccinated. If the purpose of the PHOs is genuinely to reduce the spread of COVID, there is no bias for locking out people who do not have COVID, which is easily established by a rapid antigen test. Conversely, a vaccinated person who contracts COVID should be required to isolate until such time as they have recovered. 181. Blanket rules, such as mandating vaccinations for everyone across a whole profession or industry, regardless of the actual risk, fails the test of proportionality, necessity, and reasonableness. It is more than the absolute minimum necessary to combat the crisis and cannot be justified on health grounds. It is a lazy and fundamentally flawed approach to risk management and should be soundly rejected by courts when challenged. As you all know, worldviews and the science on COVID-19 and COVID vaccines are rapidly changing. Consider Norway and Sweden, among other nations and states. We also have the question of liability. Mr. Fah's motion is really a form of coercion, i.e., put bluntly, accept an experimental substance into your body or lose your job. Adverse reactions and even deaths are constantly being reported. See VAERS, see also Facebook private groups, Canadian deaths and adverse reactions from jab, 50,000 members. See also Ontario Businesses Against Health Pass, 140,000 members, 100,000 pending. See also nomoresilence.world, etc. Besides the moral and ethical dilemmas a mandated COVID-19 vaccine creates, what are Council's legal plans in dealing with serious reactions or death caused by a mandatory vaccination? I trust no Council member would force this on any existing or future employee or volunteer. Thank you for the opportunity to voice my concerns. Please vote no to Councillor Fah's motion and the subsequent report. Yours truly, Charlie Van Kesteren.
Next deputation is from Elizabeth Dorner regarding item 17D, COVID-19 vaccine policy for council and committee members. If I understand the motion, this is a vaccination mandate for council and committee members. Why would you, council members, mandate this vaccine for yourselves? What are the medical, ethical, or legal justifications? Is it because you want to set an example to your staff who have recently received a policy regarding all municipal staff to be vaccinated by October 18th, 2021? It would be better to defeat the motion in item 17D and also rescind the policy for vaccination mandated to all municipal staff. This will definitely produce job losses for those who choose not to take the shot. How helpful is that to our municipal offices, to our county, to our constituents, to me? Please defeat the motion on 17D on the agenda or defer because 1, COVID-19 and its variants will continue even if everyone is vaccinated. The vaccines do not give 100% guarantee of the obliterate of the virus, Pfizer reported. However, it does give some hope that those vaccinated will have lesser illness. 2, to rely on one method to deal with this virus is short-sighted. Before the violent storm is approaching, is there only one way to prepare, to be ready when it hits, and have means by which to deal with the aftermath? And the only way to allow by the government? Medically, with your doctor's assistance, we can prepare with vitamins and minerals, with herbals and prescription medication. However, doctors are restricted from using repurposed drugs, even to losing their licenses when they do, or even just mention the possibility. Ivermectin is an approved drug by the WHO. It does not kill when properly prescribed to suit each individual. Its repurchasing has saved many people from going to the hospital when contracting COVID, especially in the early stages of diagnosis. In 18 months of our living with this COVID-19 virus, there are many scientifically researched papers that just need to be read and listened to. 4, by Chatham-Kent Council ignoring the recent research has to offer because of only following the narrative. You really are looking after the welfare of your constituents? Do you as councillors want to look back on your life acknowledging what you did in your role, or agonize about what you could have done? Can I count on you to carve out more paths to help us deal with the virus, or are you willing to follow only one path, mandated vaccinations? Elizabeth Dorner, Chatham, Ontario.
The next deputation is from Joseph Grutenborg. Public City Hall meetings are the heart of democracy in Chatham-Kent and should be inclusive for everyone, no matter of vaccination status, medical condition, personal conscience, convictions, or religious beliefs. Some Christian, Muslim, and Jewish representatives of faith will not take the vaccines for religious reasons. What kind of signal will be sent to them by mandating that all councillors and committee volunteers must be vaccinated or otherwise forced to undergo and divulge the results of onerous and expensive regular medical testing? Some minorities might be forced out of participation in democracy as a result. Is this not a bridge too far? An example of discrimination against minorities and council and committees to put extra requirements upon those who refuse to divulge their medical status. A medical procedure such as the injection of a partially tested new treatment is a very personal choice and in the domain of privacy between patient and doctor. Please choose instead to consider the voluntary and individual public announcements from each councillor and leader within the community, those willing to make it public, to be adequate as leading by example. An aspiration communicated by the mayor in a news article on September 27th, 2021 in Blackburn News. You are public servants called to represent all of Chatham-Kent and not just the majority. There is a minority within the public and within council and committees that is not willing to divulge elements of their medical status. And within that group are some who are in the minority because of religious convictions. Is it justified to override minority rights in order to add a bit more to an already strong message and example coming from the city? To further ensure safety that is already quite elevated with masking, distancing, and use of communication technology, the city is already doing a more than adequate job of preventing the spread of COVID. Thank you for considering my deputation and for having a healthy, open debate on this policy proposal. Joseph Grutenborg.
This deputation is about Report 17D and is submitted by George Coors. If you mandate tests and consequently coerce to take vaccines for council members and volunteers, you send the strong segregation message to our community. Statistics have shown that African American community all across North America is 70% not vaccinated. They lived through segregation. Do we want to start segregating them and others again? Let's face it, a lot of people took the jab for all non-medical reasons, not because they're afraid to get sick, but because they want to travel or go to university or to keep their job. But you don't have just a job. You represent the free and all-inclusive democratic process of Chatham-Kent community. Unfortunately, a lot of politicians on federal and provincial levels turn their own vaccination, private medical procedure, into a virtue signaling event to gain political points. But this is not what the public service is all about. Its public is for the people. Let's tell everyone that you are not dividing your own community into two-tier society. You stand with all people, you represent them all. No volunteer, no public servant should be excluded from the public democratic process and social life based on their beliefs about vaccines. You do not discriminate based on race or religion, and you do not discriminate based on people's convictions. If you took the vaccine, it's your choice and you should be protected. It's well-established fact that vaccines do not stop the transmission, but might reduce the severity of your symptoms. Look into Israel and their highest vaccination rate and high transmission rate as well. So you did your part, took the jab. Your symptoms should be mild if you got sick. Why are you worried about someone else's symptoms who did not take the jab? What if your policy will coerce them to take it and he or she will have a severe, long-lasting side effect? You don't want to live with this kind of responsibility. It's wise to not mandate any medical procedures to anybody. City council members or administration could strongly suggest or reason with people why testing or vaccine might be beneficial for them, but no policy should coerce people to take the vaccine by paying for ongoing testings every 72 hours. You are all public representatives, regardless of your vaccination status. This is the message you should send to your community. Even if some of you or all of you took the vaccine, it does not make you more privileged. It does not give you the right to exclude someone from the democratic process by banning him or her from coming to the city hall and volunteer or work as a city councillor. That's why non-disclosure of one's personal vaccination status is the ethical thing to do, especially for public representatives. It is not normal to segregate human beings and be non-tolerant towards one group of people. If I am the city council member, this is what I would say. Even if our opinion is that to take the shot is the best thing to do, by not disclosing personal vaccination status, we are sending the signal that we are all-inclusive democratic institution that represents all constituency of Chatham-Kent, regardless of their opinion on vaccines. That's why mandating tests leading to vaccines for public representatives and servants or volunteers of the City Hall is a controversial policy. We have to remain neutral, and non-disclosure is the best way to do it. We are public servants, and we represent everyone, even minority. George Coors, Chatham-Kent, Ontario.
And the last deputation, council, is on the same item, and it is from Alice Lake. If this addresses a vaccine policy in the absence of a vaccination and how those individuals may provide proof of testing, I ask you to consider as those who are fully vaccinated can also catch and spread the virus so that they should require testing as well. Or why do you stop wasting taxpayers' money and test no one? If someone has the deadliest virus known to man, why do they need a test to know? Thank you, Alice Lake.
We'll move on to item 9, consent agenda.
Mr. Mayor, this evening we have 5 reports that will be pulled. Sorry, 4. We have item 14A, the Ontario Health Team Strategic Plan will be pulled for its presentation, and we have a conflict of interest by Councillor Harrigan. Item 16C, Bothwell Sanitary Servicing and Water Course, recommendations from the Ministry of the Environment, Conservation and Parks. We have that pulled by Councillor Pinsino. Item 17B, the Consolidated Business Licensing Bylaw Salesperson Day Sales License, pulled by Councillor Sakachi and Councillor Wright. And the final report is 17D, the Vaccine Policy for Council and Committee Members. Councillor Pinsino, Councillor Finn, and Councillor Harrigan have asked for that report to be pulled. Therefore, on the consent agenda this evening, we will be voting on item 13A, 15A, 16A, B, 17A, and C.
Councillor Kirkwood-White and Councillor Krugen, each move the consent agenda, please.
So moved. Second.
Any questions? Seeing none, we'll put it to vote.
All votes are in. Motion passes 17-0.
Item 14, Community Human Services.
14A, Ontario Health Team Strategic Plan, and I'll pass it over to to April Redyke for the introduction.
Thank you, Mr. Mayor. I am certainly happy to introduce Council to Dr. Brianna Yee Providence and Tiffany Gartner-Duff. They will be presenting the Ontario Health Team Strategic Plan. There has been tremendous amount of work that's gone into this strategic plan, tremendous amount of community consultation, meeting with many boards, commissions of various members. And so I'm not going to take up any more time. I'm going to turn it over to Dr. Yee Providence, and she will present the Ontario Health Team Strategic Plan, and then certainly we'll be happy to answer any questions when they are done. So Dr. Yee Providence, if you want to share your screen and take it away, we are happy to have you here. So thank you for joining us.
Thanks very much, April, for that introduction, and very happy to be here this evening. Thank you for the time. Just want to check and make sure that my screen is seen. Perfect. Can you see that okay?
Yes, we can.
Okay, thank you very much. Good evening, Mayor and Council. Thank you for the opportunity to be on the agenda today. I've been invited to present the Chatham-Kent Ontario Health Team's 3-year strategic plan for 2021 to 2024. My name is Dr. Brianna Yee Providence, and I'm a local family physician with the Chatham-Kent Family Health Team who practices in Dresden, and I'm the physician co-chair of the Chatham-Kent Ontario Health Team. The Chatham-Kent Ontario Health Team is a partnership committed to co-designing the local healthcare system to improve access to care that is easier to navigate. You may recall we did a presentation in October 2019 where the Council endorsed the CKOHT application. We are very proud that our OHT was among one of the first announced in the province in Cohort 1 in December 2019. Since then, there are now a total of 50 Ontario Health Teams across the province. There are 15 signatory partners that form the Collaborative Steering Committee and over 100 partners that participate in the CKOHT's 3 councils, 5 working groups, and many sub-working groups. This partnership model is the basis for the vision of the Chatham-Kent Ontario Health Team, achieving the best health and well-being together. The CKOHT strategic plan was developed by the people who live, work, and play in Chatham-Kent. We utilized the municipality of CK's Let's Talk Health CK webpage to host a survey which received 1,762 responses from the public. The survey asked residents about their barriers to accessing healthcare, the COVID-19 pandemic's effect on their health, and their experiences with healthcare in CK. We also launched an open online question asking residents their priorities for healthcare. Over 300 priorities were identified and endorsed over 6,880 times. We also engaged with many community members and key stakeholders to learn and understand their healthcare needs through 15 focus groups with 91 participants. One such focus group occurred in June 2021 with the CK Mayor and Council. We thank you for your participation as it has helped shape our priorities moving forward. The culmination of this is the strategic plan I'm excited to be presenting to you today. We are entering an era of opportunity to come together to make positive change for our residents, patients, and caregivers and their families. We have set 5 bold goals to help us improve healthcare in many innovative and collaborative ways in Chatham-Kent by 2024. This slide illustrates our 5 strategic goals. Each represents a priority area and a high-level overview of our specific areas of focus. Our first goal is population health and well-being. We will transform the healthcare journey for the CKOHT population. Our focus will be to improve the healthcare experiences of those in our priority population. This includes those aged 55 plus with chronic and complex medical conditions such as diabetes, COPD, congestive heart failure, and dementia. Given the identified significant impact of the pandemic on mental health, we are also expanding our focus to include mental health and addictions. We look forward to partnering with the municipality on mental health and addictions as we recognize the significant impact of opioid-related harm that has increased significantly during the pandemic. We hope to achieve this by creating partnerships within the healthcare system to decrease fragmentation and improve access to the right care at the right place at the right time. Certainly, there have been significant impacts from COVID-19, and it is important that we establish a COVID-19 recovery strategy. In the past 18 months, the Chatham-Kent Public Health Unit has been a leader in our community for the COVID-19 response, and we have been grateful for their collaboration and partnership with our Ontario Health Team that has led to many COVID-related initiatives such as outbreak management, the remote monitoring program, testing and assessment centers, vaccine administration, community engagement, and pop-up clinics to serve our rural community. We look forward to continuing to respond to current COVID-related needs and shifting our focus to a recovery strategy when the time is right. Our second goal is health equity. We will achieve a health system that is safe, equitable, and free of stigma for everyone in CK, including Indigenous, Black, people of color, Francophone, immigrant, LGBTQ, and temporary foreign workers. We know that there are about 20,000 CK residents that do not have access to primary care. Knowing this is the entrance to our healthcare system, this leaves many with limited access to healthcare. We plan to focus on strategies to recruit and retain family physicians and nurse practitioners in CK. By working closely with our primary care organizations and physicians to identify opportunities, barriers, and strategies for recruitment, but also on retention and wellness of those already here so they can continue to care for those in our community. We are committed to working with our Indigenous leaders and partners to improve the health and well-being of Indigenous peoples. It is important for people of all walks of life, no matter the color of their skin, religion, ethnicity, gender, sexual orientation, or the language they speak, to be able to access healthcare without any kind of barrier, such as racism, oppression, inequity, or bias. Our third goal is maturity. We will deepen and grow our partnerships to accelerate maturity. As the Chatham-Kent Ontario Health Team grows, we will expand to include additional partners, particularly in the social, community, and support services sectors. As we evolve, we will adjust how we are governed and organized to support new committees. The COVID-19 pandemic has significantly impacted the health of our healthcare workers. In response, we have created a human resources working group to focus on healthcare system recruitment, retention, and wellness strategies. As COVID-19 continues to challenge us, we need a healthy workforce to ensure we can continue to care for those in Chatham-Kent. Our fourth goal is community. We will always remember our purpose and be ready to tell our story. Our aim is to raise awareness and knowledge so everyone knows our purpose and responsibilities to improve access to healthcare and make it easier to navigate the healthcare system. We put people and patients in the forefront of all aspects of our work to ensure we take a person-centered approach to healthcare planning and decision-making. We also endeavor to share best practices of what's working well so we can learn from each other. Our fifth goal is performance. We will be innovative and accountable in achieving system performance. We don't only want to be a great Ontario Health Team. We want to become a leader in the province, implementing evidence-based practices for improved healthcare. One way to become a leader is through safe, seamless, and secure digital health solutions to improve the overall patient experience. We believe in accountability and transparency, which means we will regularly provide updates on how well we are doing at achieving our goals and objectives. That was a very quick overview of our strategic plan. If you would like to find more about our partnership or our strategic plan, please visit our newly designed website. On our strategic plan page, you will find strategic plan documents, a video, and also includes our strategic plan monitoring document. This will be regularly updated so you can follow our progress in achieving our goals and objectives. I've also included 3 main social media platforms, which we actively post updates and information. In closing, we are looking forward to the next 3 years and what we at Chatham-Kent Ontario Health Team will achieve together. It is our goal that healthcare is simpler to access, easier to navigate, equitable for all, and puts the person and patients first in everything that we do.
Any questions? Councillor Latimer.
Thank you through the mayor. Thank you very, very much, Dr. Ye Providence, for that presentation. I'm so pleased to hear that the care of our caregivers is included in this plan. Everyone realizes the stress right now and the lack of resources for staffing across the community at every level is an ongoing issue. I did wonder what the timeline is with regard to reporting back to council and into the community about how you're meeting your objectives and the goals across the next 3 years.
So I think that right now we are really focusing on trying to create our workflow mapping to try to ensure that we identify kind of our strategies and areas that we're going to work on with very busy sub-working groups. I would say probably the pandemic did set us back a little bit, but we are now kind of up and running at full steam, that our strategic plan has been completed and we're moving forward with working on it. Our hope is that we do this annually so that we can provide continued updates to council in terms of our progress.
Wonderful. Thank you again for your presentation and all the great work that all of your teams are doing.
Thank you very much.
Thank you for that. The presentation was really clear and concise, and it only generated one question, so thanks for all the work you're doing. With that, we'll let you go and enjoy the rest of your evening, and we'll move on to item 16, community development.
Thank you.
16C. Bothell Sanitary Servicing and Water Course, recommendations from the Ministry of the Environment, Conservation and Parks.
Councillor Pinsino and Councillor Wright, can I get you to move this, please?
Yes, I'll move it. Councillor Pinsino.
I'll second it. Thank you, Mayor.
Okay, Councillor Pinsino, you had a question?
Yes, with the ministry order, I realize we have to do the survey. Oddly enough, I've had a few of the merchants in the downtown contact me here, well, as recently as this morning. And they say they do need some sort of a system. They said their septic systems are overtaxed on that main street, and there's no real estate to expand their systems. So they recognize that there is, they have to do something down there. I guess in the report, I read it through a couple of times. It does report that the main target is the main street. It's the biggest hotspot. Question I have for staff, in this report, it states that there could be just an alternate system put in for just a certain area, or it could be a community-wide. Can somebody explain that a little better?
Thank you, Mayor Caniff. It's Paul Lucina speaking. So your question was, I'm sorry, Councillor Pinsino, back to whether it's I think what the report is saying is that, depending, and we can use your example of the downtown area. If we find that there's a number of failing systems there, and obviously there's not any land to put these systems in, then an option could be by the consultant is to put in like a communal system where each of these properties would feed to.
For that area.
Or that area, yes.
Or they could recommend the whole community, correct?
Yes, we'd have to see what they find.
Yeah, as everybody knows, this has been a hot topic item in Bothell for several years, like a decade or more. Well, I'll have to wait and see what the results come in, and we'll go from there. Thank you.
Seeing no other questions, we'll put it to vote. Oh, sorry, it's in from. Oh, yes, we'll put it to vote.
All votes are in. Motion passes 17-0.
We'll go on to item 17, corporate services.
17B, Consolidated Business Licensing Bylaw, Salesperson, Day Sales License.
Councillor Sakachi and Councillor Wright both had some questions, so I'll go to Councillor Sakachi first and then over to Councillor Wright.
Thank you, Mayor Caniff, and through you to, am I correct in stating that Nancy is on the line, Judy?
Yes, she is.
Yes, so I just wanted to have a quick question for you, Ms. Havens, in regards to the aspect in the report regarding Guelph. Is this something that we can kind of monitor moving forward and see how, maybe touch base with them and see how it progresses to see if it's something that we can entertain in the future?
Thank you, Your Mayor. It's Nancy Havens, Manager of Licensing, speaking right now. Absolutely, Councillor Sakachi, we can do that. We can check with them to see how it's going, to see if we can get some stats and bring it back to council when there's more information to bring.
Thank you, Nancy. I do appreciate the report. I know that, it's a very fine line between impacting the bricks and mortar businesses in our community, as well as realizing with COVID and the current pandemic that there's different ways that people have to operate their businesses. So, it's just very important. I think that we recognize that we try to at least stay up to date on, maybe for potential chances for people in our community to kind of go across other ways to conduct their business. So I do appreciate the report, and it might be something I can ask for information report at a later date if we have some conversation and you feel it's something that we can monitor and look forward to. So thank you.
Councillor Wright.
Thank you, Mayor Caniff. My question was, this was events. Is this for vendors at other festivals at our community? Or farmer markets vendors, or is this like where's the which ones will be charged this and which ones won't be? That was, I just couldn't figure it out in the report there.
Oh, okay. Through you, Mayor Caniff. It's Nancy Havens speaking again. This report was specific to sort of mobile vendors throughout the municipality and how would they affect and what zoning would be required and everything that goes with it. So think of it was more like a vendor that wanted to sell blankets outside of a Canadian Tire or outside of a Walmart or outside some other commercial property. This specific one is not related to farmers markets. With farmers markets, they're regulated by the health unit usually. And sometimes food vendors may require a license in markets. Does that answer your question?
So all of our small festivals that we're having through our community, where they set up their tents and that, they'll be exempt?
Correct. Any event on municipal property that goes through this special event process is exempt, yes.
What about the ones that aren't on the municipal properties? They have their small festival.
At the current time, we do not, we're not licensing a temporary sales at this time for a special event on a private property.
Okay, all right, thank you.
Councillor Bondi.
Thank you, Mary Caniff. I don't know that this is in the same category. Maybe it is. The door-to-door people that come to your door to sell you internet access, some sort of natural gas providing service, etc. This is not in the same category, I assume. That's a question.
It's under, sorry, Your Worship, to Councillor Bondi, the door-to-door salesperson is under the same bylaw. However, it's a different set of rules. And the ones that are fiber optic are also a different set under that bylaw, but it has nothing to do with this report tonight.
No, okay, thank you, and
Yeah.
through you, okay, well, if I could go with your permission, Mayor Caniff, if I could go just a little bit off topic. The door-to-door people that come, are there regulations? I know they have to pay a fee. I'm only talking about this because I've experienced it in the last month. And the person that attended my door did have a Chatham-Kent, some sort of tag, which I didn't inspect very closely, because I assume it looked pretty legitimate to me. But are there regulations on how many times this guy or person can knock on my door? And again, with your permission, Mayor Kent, because I know it's not part of this report.
Yeah, we'll keep that one brief question. I'll allow that, and then Nancy can answer that.
Through Mayor
Thank
Caniff, the door-to-door salesperson that would have been going around right now, the only one we have licenses for fiber optic sales. And council back in April of 2019 permitted reduce the fee. So you'll see more sales people out regarding fiber sales right now to help with the fiber internet, getting it to all the properties.
So again, I'm sorry, is there a limitation on how many times they can come to your door?
They have to get a license every 3 days, but there's no limitation how many times they come to your door. They should know not to come back though if they've already been there, but there isn't anything in the bylaw.
All right, well, my guy didn't get the memo, but okay, thank you very much. I appreciate it.
You're welcome.
Councillor Scotch, I'll allow a quick question.
Actually, Mayor Kaniff, just a quick comment. I just wanted to clarify, point of clarification, that according to the report, nothing is changing and there's going to be no additional changes to the current bylaw. And I just wanted to ensure that everyone is aware that nothing is changing. There was recommendations was to stay rather status quo. Is that correct, Nancy?
Correct. Yes, there's an information report.
That's correct. Just wanted to make sure that clarification was made.
Thank you.
Thank you.
Thanks. We'll move on to the next item.
17D, vaccine policy for council and committee members.
Councillor Foss and Councillor Harrigan, can you move this, please?
Thank you, Your Worship. I'm pleased to move it.
And I will second the recommendation, Mayor Caniff.
Councillor Foss, did you have anything to say, or because Councillor Pinsino had a question or concern? Is there anything you want to say?
First of all, yes, Your Worship, I would like to thank Kathy and her team, as well as Dr. Colby, for the input in putting this policy together. I think the policy speaks for itself, and I'm pleased to see that it's being brought forward today, and I encourage each one to support it. Thank you.
Okay, Councillor Pinsino, followed by Councillor Kirkwood-White.
Thank you, Worship. I realize this item here talks about council and committee members. However, it mirrors the employee policy, and I won't have a chance to talk on that because that has already been brought in. So I'm going to ask questions here. Personally, I have a problem with 13B, testing at their own cost and time. I've been contacted by several firefighters who say they will not get the vaccine and they will not pay for their tests. So I have a question for Chief Case. What's the contingency plan if the firefighters do walk off?
Through you, Mr. Mayor. Good evening, everyone, and thank you for your question, Councillor Pinsino. Right now, we do not know how many firefighters may choose to take that course of action. So it's difficult to work out what the scale of the challenge would be when we don't know what the impact would be. However, as you know, our firefighters are linked very closely to the area where they work and where they live, but we already have contingency plans to deal with such things as a second call to another station, or if we don't have a lot of firefighters come because they're engaged elsewhere. And the only contingency plan we would have right now would be to, first of all, send the nearest station to support that station if they had a shortage of staff. And in the longer term, we would have to recruit more firefighters. That is the only answer I can give you right now, Councillor.
Okay, thank you, Chief. I got a question for Ms. Hoffman as well. Firefighters do tiered response with EMS. And how's the municipality dealing with EMS as far as either vaccinated or testing? Do they pay for it, or how's that done?
Thank you, Mr. Chair. Our EMS folks have as you know, Councillor Pinsino, we have a purchase service agreement with our EMS folks. They have their own policy, and their policy right now is a mandatory vaccination subject to an exemption, and they also have testing requirements, and they are providing those for their employees. They have something underneath the provincial regulations that allows for them to have tests available for their employees to get tested.
Okay, on that same wavelength, would that not apply to any firefighters that do tiered response?
I can take a first stab at that question, Mr. Chair, and then perhaps Mr. Taylor or Chief Case may also want to jump in. But Councillor Pinsino, our firefighters are not captured under the same legislation that our paramedics are covered under provincially to entitle them to having access to free tests and so forth. So they would be caught under the municipal. So it's the Land Ambulance Act, I believe it is, that they're captured under. So our firefighters, though, would be captured under our own policy that you have seen attached to this particular policy. And again, I'll just pause for a moment to see if either Dave Taylor or Chief Case would like to add anything to that answer.
Thank you, Mr. Mayor. It's David Taylor. I don't have anything to add to Ms. Hoffman's response.
Mr. Mayor, Chief.
Oh, sorry, go ahead, Chief.
No, it's okay, Councillor. I was just going to say I can't add any more neither.
Okay. And I assume that CK Police are under the same policy as what our municipal employees are. Is that correct?
Thank you, Mr. Chair. CK Police have also passed a vaccination policy very similar to the one that you've seen here for staff and for your own draft policy. So it is also a vaccination verification and testing policy, yes.
Okay. I guess another one of the complaints I had, Ms. Hoffman, is the rollout timing. It's got people frustrated that it's not even possible to meet the deadlines. Are we looking at anything there to try to make that work?
Thank you, Mr. Mayor. We have certainly taken a lot of feedback from our employees and supervisors, and where employees are struggling with any component of the policy, we've asked them to contact us directly, and we can work through the issues with them. And so that's, we also have been communicating with our staff in advance of the policy coming into effect. So this hasn't been a surprise that we're headed down this path, but nevertheless, certainly if there's employees with trouble accommodating these needs, for them to give us a call and we'll work through the problems with them.
All right. I'd like to see the clause removed at their own cost out of this. If I'd also like to wait till October 18th until you know, the results come back of who is vaccinated and who isn't and what kind of numbers we're talking about. Is it possible? Do I need a 2/3 vote to remove it out of this one if that stays in there today?
So, Mr. Chair, the employee policy is not one that council was voting on. The policy, or sorry, the report that you're looking at this evening is dealing with the council and committee policy.
I realize that, but what I'm saying is I'm going to bring a notice of motion after I get my numbers to remove that out of the employee one because it's never been dealt with. However, this one here is going to be dealt with tonight. My question is, does it take a 2/3 vote to have that part of it removed?
Thank you, Mr. Mayor. It's Judy. From a procedural perspective, because the employee policy has not been voted on by council, it would not require a 2/3 vote.
But this one tonight, would it?
The vaccine policy for council and committee members would, yes.
Okay. The only problem I got with doing that right now is it's probably not going to pass on this one. I think I'm going to wait and see my numbers, and then I'm going to deal with the employee one when the numbers come back in. Okay, thank you.
Okay, before we move on, I wanted to go to Ms. Hoffman. She has a couple slides she just wants to show, just to put in perspective. So I'll pass it over to you, Ms. Hoffman.
Thank you, Mr. Mayor. I'll just maybe speak to the slide rather than show it, just for expedience here. I had been asked the question previously about what were comparators around us, geographically around us, doing with their policies. What did they look like? And was the Chatham-Kent policy similar in nature? So I'll just share a little bit of information with you about that. So Lambton County has a policy similar to Chatham-Kent's. It's a vaccination and testing policy. So yes, they do testing, and the onus is on the employee for both getting the tests on their own time and for the payment of same. The other municipalities that are similar to that are Sarnia, St. Thomas, Leamington, Kingsville, Tecumseh. Peel as well, that's not around us locally, but to share with you, it's one of our data points. The others geographically are around us that have a mandatory policy, and I'm happy to speak to the difference between the two, is Windsor and London. So they have a fully mandatory policy. Mandatory meaning that you are required to get a vaccination to work in those locations subject to an exemption, and there is no testing. So therefore, testing wouldn't take place on the employee's time or at their cost because there isn't testing. But the significant difference being that there isn't an option for testing. So in a true mandatory policy, the true mandatory, you heard some deputations tonight speak about us implementing mandatory policies. And I think it's important just that everyone's clear that the Chatham-Kent policies that are being developed are not mandatory policies. They're policies that offer an alternative to vaccination, and that is the testing, differentiated from Windsor and London, who testing is not even an option. Does that help?
Yes, thank you for that clarification. Councillor Kirkwood-White, did you have a question? Or I see you put your hand down.
I took it down because she guessed what I was going to ask.
Perfect. All right, Councillor Finn, followed by Councillor Crew. Councillor Finn, you're on mute.
Sorry, I thought I hit the unmute. Mine's more of a statement with some questions included into it, but thanks to everybody who's reached out to me over the last few weeks regarding this policy. I listened to numerous callers, read many emails, and replied to everybody. Listened to both sides, and I'd like to state that I am not against policies, nor am I against vaccines. I've known people who have had all stages of this virus, both vaccinated and not, and I've known a few who have passed away. Known people who have had no side effects from the vaccination to those who have sought medical attention. I sat down this weekend looking at everything that's been presented to me, and I'd like to just speak to some of the concerns that came up. Section 13, declaring to our training room, or OTR as it's referred in the policy, it's a website. Many don't feel that they should be declaring to an internet source. You're not speaking to somebody, you're declaring over online about their intent. And we're now putting a person's beliefs and status online where anyone with knowledge could access this information. In my belief, it violates the Personal Information Protection and Electronics Document Act. I could be wrong, I'm not a lawyer. As well as Personal Health Information Protection Act. The Municipal Freedom of Information and Protection Privacy Act in relation to a case of a municipal worker, volunteer, or counselor who have chosen not to disclose their personal medical information in regards to their vaccination status. Privacy laws are also overlooked and violated when it states required to declare personal vaccination statuses and required to provide proof of vaccination. The policy can only encourage or strongly recommend disclosure of personal medical records. Otherwise, it's the same as if the policy requires the person to disclose and declare one's medical status, whether it be Hep C, HIV, allergies, or even an autoimmune disease status before entering a building. Section B violates Genetic Non-Discrimination Act. It is prohibited for any person to require an individual to undergo a genetic test as a condition of providing goods or services to that individual, entering into or continuing a contract or agreement with that individual, or offering or continuing specific terms or conditions in a contract agreement with that individual. The exemption to this act is given to medical providers who are providing health services to the individuals. In order to do so, the medical provider must obtain voluntary consent according to the Healthcare Consent Act. Therefore, even medical providers cannot administer the test without the informed consent of the individual. I believe that the policy could be viewed as an excuse to practicing medicine without a license, as it uses terms submit to ongoing testing, which in other words, in my interpretation, is a prescription or order to undergo medical testing or procedures. Municipal administration is not a licensed medical provider, and even if they were testing, could not be provided without the informed consent. I also looked up the members' responsibility section in here. The demand is a violation against the municipal worker, volunteer, or counselor who has chosen not to disclose his or her personal medical information in regards to one's vaccination status. It also states to adhere to any additional mandates, etc., from provincial or federal authorities regarding vaccinations. This to me I viewed it was misleading. It makes it look like the municipal administration policy draft is somehow a document that came from either the provincial or federal government. Wondering why that language was used. The intention may not have been to mislead anyone, but could be interpreted as an intimidation factor by a municipal worker, volunteer, or counselor. There is a directive by the provincial government to create our own policy. The municipality was not given either the provincial or federal policy to use. Paragraph 8, Section A violates the Nuremberg Code, in my view, and constitutional laws. It states submit to ongoing testing at their own cost and to be completed 72 hours prior to conducting any activity associated with the fulfilling of their duties. I believe that's been changed, but the term any activities is very broad. My interpretation is this policy mandates medical treatment such as testing or vaccination, even if the worker is working from home. There is no health and safety concern in this case. Again, could this be viewed as a coercion tactic to make someone take the vaccine? Section 1 of the code states the voluntary consent of the human subject is absolutely essential. This means that the person involved should have the legal capacity to give consent and should be so situated as to be able to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion, and should have sufficient knowledge and comprehension of the elements of the subject matter involved as to enable them to make an understood and enlightened decision. I also spoke to several who were in support of the double vaccination policy, and I have addressed some of their concerns. Again, I am not against the vaccine nor the policy, but for those that are double vaccinated, you had a choice. And I'm okay that people chose, but was it because you were ordered to do so? Or to lose a privilege of doing an activity or traveling somewhere or to see a loved one? Again, it was a choice. Most of the one that supported it, they want the pandemic to be over, to feel safe, going into some place, either work, the gym, wherever. Again, I understand it. I don't know of anybody that doesn't want this pandemic to be done. The majority of the population has been vaccinated. According to the public health online over the last 18 months, 6% of the cases have been a worker or resident of a congregate living care setting. 59% was because of close contact. Healthcare workers is less than 6%. Over the last 18 months, 2,367 people came down with the COVID and were never hospitalized. 84 people, or 3.4%, were hospitalized, and 1% was admitted into ICU. Would I like to see those two percentages, the 3.4 and 1, be zero? I would, and as I don't know of any doctors or nurses that wouldn't like that, whether they're vaccinated or not. It's been a hard 18 months on everybody. Now, will those numbers decrease when employees are suspended without pay, fired, or some resign? Possibly, but when there is a shortage across the country in many areas, workers left behind to cover shifts with less people to choose from. When I was an officer, if a shift was short-staffed, the policy stated no day off would be granted if overtime had to be ordered. I would presume the policy is still the same. The workers over the last 18 months have gave their all as a team during every shift. They followed safety guidelines for the better of the workplace and the residents of this municipality. They didn't question whether their co-worker was vaccinated or not. Why? Because they needed each other to get through this pandemic, to survive and become victorious. I am wondering.
Councillor Finn, a second. How much more longer you have? We're limited to 5 minutes per. Per councillor.
I've got 3 pages. I didn't know I was limited to 5 minutes. I very rarely speak, and this was the topic that, yeah, it struck home.
So how much longer do you have?
I have 3 handwritten pages.
Remaining?
Yeah, I write big.
Okay.
It's not little.
If you can wrap it up, but I guess for future reference for councillors, we do have 5 minutes. So.
Okay,
Thanks.
sorry, nobody told me that one, so I apologize. I'm wondering if each workplace was consulted and employees' views asked. What will happen to our budget when people are called in daily on overtime? What will happen to our employees' morale? What will happen to their family and their mental health? Has all of this been looked at prior to this policy being drafted, or did administration just draft it without looking at the whole outcome? I believe that everyone has a choice and no one should dictate how someone chooses to feel. When I look at the policy, there is no choice for those that do not wish to vaccinate, only more punishments. There is no option if should the unvaccinated catch this virus, then the time off required to heal could be at their own expense, or sick time or vacation time would have to be used, as apparently a lot have not been able to use vacation time. I was always taught that everyone had a voice and a right to be heard. Again, I am not against vaccine, nor am I against the policy. I'm against not listening to some of our heroes who all they want to do is what they were hired to do and to work together to get through this pandemic. Whether or not you're vaccinated or not, you can still catch the virus and transmit the virus. And it is still unknown as to whether another variant will be affected by this vaccine. Face masks, social distancing, and hand cleaning are still going to be important, whether you have 1, 2, or no shots. And remember that the unvaccinated person may have been informed by a medical physician not to receive the vaccine. And again, they could be at risk going into work, doing what they love. That's it.
Mr. Taylor, do you have some comments?
Thank you, Your Worship. Yes, this is David Taylor, Director of Legal Services. In Councillor Finn's comment there were a number of items that touched on some legal points, and so I'll speak to those and then pass it over to Kathy Hoffman or Dr. Colby for the other aspects of Councillor Finn's comments or questions. So the first legal item I noted was the question about the protection of the computer program or service that will be used for uploading of vaccination information or tests. And so I can confirm to council that every new service that the municipality uses is run through a privacy impact assessment that involves legal review of the contractual terms and security tests by our ITS, Information Technology Services team. That did occur with this website, and all of it is in line with what we would expect. Of course, the municipality uses services like this for many deliverables that include personal information or personal health information. And so I can provide council with confirmation that this is in line with our practices. Also spoke to the idea that this vaccine policy violates the Nuremberg Code. Say very clearly to council that's not the case. Vaccinations are a normal thing in our society. It's not a medical experiment that was captured by the Nuremberg Code. I think that has been spoken about in numerous different media forums, and that this is absolutely an appropriate medical intervention to deal with the serious health implications of the pandemic. The reason for this policy, just to bring it back to the legal basis for it, is an occupational health and safety requirement to address health and safety in our workplaces. And that is the rationale for it and the legal basis for requiring the policy for employees. I would also just comment that the motion before council tonight is actually one about council's policy, whereas this discussion seemed to be largely about the employee policy, though they do cross over obviously in a number of the clauses. So with that, I believe there were some matters about employee engagement and some other items. I'll turn over to Ms. Hoffman.
Thank you, Dave. Mr. Chair, I'll address just a couple of those points. So the consultation process was fairly rigorous. We had a number of sessions that we met with various employees, supervisors, managers, directors in the organization. We shared with them a draft policy, the draft of which came from consultation with numerous of our municipal partners across the province. Everyone has collaborated very well to be trying to get the very best wording and policies, the clarity, what's needed, chafing out what is not needed, etc. And so our consultation process went over a few different days, and we also engaged our union leadership and received input from them. And with all of that input combined, we went back and did some edits to the actual policy, and then drove that policy out to the organization from that point forward. So certainly we had lots of input and lots of really good ideas, and it absolutely shaped what the final product was from there. Dr. Colby, was there anything that you wanted to add in addition?
Yes, thank you, Your Worship. I'm not a lawyer, but several depositions made reference to the Nuremberg Charter, and I know a little bit about that. And it arose because of unethical, violent experiments that were performed without consent on people who were prisoners of conscience and prisoners of racist doctrines in Nazi facilities. And to draw a comparison between vaccinations which are fully approved, not experimental, have an overwhelming safety record and are designed to improve the health, the welfare of people through both personal protection and protection of those around them. I'm very, very disturbed by this, and I hope I'm not out of line expressing my dismay with regard to that. I would also like to take the opportunity to say that there are no human tissues or fetal cells in any of the commercially available vaccines that have been approved by Health Canada, and as far as I know, any other vaccines around the world. Everyone seems to be concerned about side effects of vaccines as a probable outcome of people getting vaccinated. Almost 55 million doses have been administered in Canada, with only 4,288 side effects classified as serious, which is 0.008%. 117 deaths have been linked to vaccination, mainly linked in time. Most of these were determined not to be due to vaccination. 69 were undetermined. 42 are still being investigated, so we don't know about those yet. And 6 deaths, 6 have been confirmed to be due to vaccination, all of which were the thrombotic thrombocytopenia, rare blood clotting problem associated with AstraZeneca vaccine. Compare that to the 28,000 plus deaths from COVID in Canada. And it is so much safer to get the vaccine under all circumstances. So we should not be talking about the possibility or the probability of having side effects. What we should be talking about are ways to encourage people to get vaccinated and stay safe. Thank you.
Okay, we'll go to Councillor Crew, then Councillor Harrigan.
Thank you, Mayor Caniff, and thank you, Dr. Colby and Kathy Hoffman, for answering some of my questions. I was stroking them off. I just have a couple, just maybe one left. In the council committee policy, Kathy, if you could answer, this only affects volunteers going into meetings in municipal buildings. Is that correct?
Thank you, Mr. Chair. So yes, Councillor Crew, if the volunteers who are sitting, who are council appointed from committees come in to attend meetings, or let's say, for example, if they came to a municipal facility to pick something up or drop something off in the course of their work on the committee.
This wouldn't affect like the BIA meetings or anything like that, those committees?
So those committees are generally, those meetings are generally held at another location, not at a municipal site. Now, yeah.
Go ahead.
Yeah, no, go ahead.
Oh, that was it. I just wanted that answer. And just a comment. I have heard a lot about paying for tests and things like that. And I'm getting a lot of feedback from people that feel as taxpayers, they shouldn't be paying for those tests if you so choose to go that route. These are choices, and we keep throwing around the word choices. We can choose to be vaccinated. We can choose, if not, to be tested. But we have to choose for the safety of our workplaces and our community. And I'm going to support the motion. Thank you, Councillor Foss, for bringing it forward. And I don't care if you criticize me for saying this, but leading by example. We are like a year and a half into this plus, and we are all fatigued by COVID. If you could just choke the life out of anything, it would be that. But we are tired of it. We're tired. We're fatigued. We're sick of dealing with it. We're sick of the divisiveness. I'm probably said that wrong, of our community. Like, we're so divided. I've never seen anything divide us as much as is dealing with this. I hope we soon get through this. I see the vaccine as a tool to get us out of this, and I'm going to support it, and I hope that the rest of our councillors do as well. Thank you. That's all I have.
Councillor Harrigan.
Thank you, Mayor Kenneth, and thank you to Dr. Colby for answering some of the questions that I had based on our deputations. I think the deputations and some of our comments that we've made tonight at council tell me, at least, that we need to do more work in helping people understand what it is that is in the vaccine, what resources that people have available to them to learn more about the vaccine, and certainly what this policy represents, both the council policy and the shared employee policy. This is not a coercive policy. This is not something that is forcing people to do things. Rather, it's outlining the process for which we will make safe our public spaces, which is something that, as public servants, both elected and employed public servants, we have an obligation to do, right? Is to serve our community and keep our community safe. So Dr. Colby, I hope you continue to advocate loudly and share with us as councillors and also the community at large important information about the science and the research behind the vaccine. And I just wanted to commend Ms. Hoffman and her team, and also Mr. Taylor and their teams for bringing up this policy. I've had a lot of active conversations with people as well about this, and the majority, actually, I think all of the responses that I had when I had shared with them what our processes ultimately were, was around disclosing your vaccination status, or if you choose not to, or if you are unvaccinated, testing to ensure people around you are safe. And that's been something that has been recognized as being a very reasonable approach given the pandemic we're in. So I also will be supporting the vaccination policy for council and committee members, and I hope my colleagues will do so as well. Thank you.
Councillor Sakachi.
Thank you, Mayor Kaniff. Just a quick question for Ms. Hoffman. Just for Ms. Hoffman, for the people who haven't had the opportunity to go through the policy in detail, can you speak of if there's any differences between the one that's going to be outlined for committee members and council, as well as the one that is going to be rolled out for staff? If there's any differences, or if they're similar?
Thank you, Mr. Chair. Yes, certainly happy to do that, Councillor Sakachi. A couple of things. First of all, we know that the employee policy is one that we have employees coming and going regularly. So in the situation, one of the differences would be that our employees are going to be testing every 72 hours. So if they're not vaccinated, whereas in the council policy, you would have the opportunity then to just test in advance of coming to one of your particular meetings, or when you might be coming here to conduct business as a result, to fulfill the duties that you have related to your various your committee or your board role. So that would be one thing that would be different. The other thing that is different certainly is the way in which the policy becomes enforced. So with the employee policy, we will treat that policy the same way we do every policy. So there would be an expectation for compliance to the policy. And in the absence of compliance for the policy, we would be initiating conversations with the employee. And if necessary, there would be consideration for the application of discipline to be applied. In the case of council, though, of course, since council members are not employees, the enforcement is a little bit different. This would come underneath your code of conduct and essentially then be something that would be enforced through that code of conduct or through the integrity commissioner. Those are a couple of differences, biggest differences I would point out just out of the gate, Councillor Sakachi.
Yes, thank you. And I know that for the the general public, they might have not had the opportunity to go through them yet. And I just thought it was important to ensure that from the main state standpoints, though, these are very much mirroring each other, though. So what we are going to be required to do, it mirrors what is going to be, in the workforce. So, I think that, it's very important to state that this is just for the committee. And I know there's some of the comments might have some confusion, but the one we are voting on tonight is only for the committee members and council members. And I just wanted to have that clarification and open for anybody who has not had the chance to read through the policies. Thank you, Ms. Hoffman.
You're very welcome, Councillor Sakachi.
All right, seeing no other questions, we'll put it to vote.
Mayor Ken, if I had to move onto mobile, so I'm not sure how to vote, and I wanted to vote in the affirmative.
Clerk's office will record that. Thank you, Councilor McGregor.
Thank you.
Therefore, all votes are in and the motion passes 14-3.
All right, we will move on to closed session reports. Councillor Hall.
Thank you, Mayor Kenneth. Closed session report for Monday, October 4th, 2021. Absent were Councillors Carmen McGregor and Jamie McGrail. Council directed on labor relations or employee negotiations with regard to union negotiations, Section 239(2)D of the Municipal Act. And council received information on labor relations or employee negotiations and advice that is subject to solicitor-client privilege, including communications necessary for that purpose with regard to vaccination policies for municipal staff and contractors, Section 239(2)D and F of the Municipal Act, and that is so moved, Mayor Kenneth.
Councillor Sakachi, can I get you to second that, please?
So moved, Mayor Kenneth.
Seeing no questions, we'll put it to vote.
In the affirmative again, it's Councilor McGregor.
Thank you. Waiting for two more, council, please. Okay, all votes are in. Motion passes 15-0.
We'll move into non-agenda business. Councillor Hall.
Yeah, thank you, Mayor Kenneth. Just really quickly, just wanted to announce that WAMBO is taking place this upcoming weekend in Wallaceburg. Normally it takes place the second weekend in August, but due to the pandemic, we decided to shift it to Thanksgiving weekend for this year. So just quickly, Friday night, Leave Those Kids Alone are going to be playing in downtown Wallaceburg. They're kind of a youth teenage classic rock band who have a great sound, so that's really exciting. We're also having the Terry Glover Memorial Dream Cruise starting at 7 o'clock downtown Wallaceburg. And then Saturday, October 9th, the Wallaceburg Farmers Market, the final one of the year, is taking place. And we're really excited as the board of directors for WAMBO to be working with the Wallaceburg Farmers Market. So that's from 8 till 12. And then throughout the day, there's going to be a car show and fire truck and motorcycle displays, boats downtown, as well as more live entertainment, which will be announced this week as long as Facebook doesn't stay down any longer. So thank you very much, Mayor Kenneth.
Okay, we'll see nothing else on there. We will move to the first and second reading. Councillor Solomon, Councillor Pinsino, can I get you to move this, please?
Moved.
I'll second it, Your Worship.
Anyone opposed? Motion carried. The third and final reading, Councillor Foss, Councillor Thompson. Can I get you to move this, please?
So moved, Your Worship.
And seconded.
Anyone opposed? Motion carried. Resolution of council in closed session and adjournment. Councillor Hall, and I'll get Councillor Wright to second this, please.
Thank you, Mayor Kenneth. I move that Chatham-Kent Council adjourn to its next meeting to be held on Monday, October 18th, 2021, and that Chatham-Kent Council authorize itself to meet in closed session on that day to discuss any matters permitted by the Municipal Act.
Now, second that, Mayor Kenneth. Thank you.
Perfect. Anyone opposed to ending at 7:31 p.m.? Hearing none, we'll adjourn the meeting. Thanks, everyone.